students, myself Dr. Pallavi. Today I am going to discuss about necrotizing enterocolitis. First of all, what is necrotizing enterocolitis? Necrotizing enterocolitis is nothing but necrosis of part of small intestine, or it could be a part of large intestine. It is common in premature infants and the incidence is inversely proportional to the gestational age, which means if the fetus or if the baby is gestational age is more, then the chances of having necrotizing enterocolitis is less. Whereas if the gestational age is less, that means the baby is premature, then the chances of having necrotizing enterocolitis is more. The incidence is 1 in 10 very low birth weight babies. Very low birth weight means it is less than 1500 gram. The pathogenesis for necrotizing enterocolitis could be multifactorial. One is prematurity, as I already mentioned. Other one is enteral feeding, and third is inflammatory mediators. Now, how the enteral feeding will cause necrotizing enterocolitis? Enteral feeding will introduce bacteria into the gut of the baby, because of which there will be tissue destruction. Coming to inflammatory mediators, there are so many inflammatory mediators. Amongst them, one is platelet activating factor. This platelet activating factor causes increased mucosal permeability, because of which the breakdown of mucosal barrier occur, and this breakdown of mucosal barrier will permit transluminal migration of gut bacteria. Now, because of this permission, there is development of a vicious cycle of inflammation, mucosal necrosis, and further bacterial entry. This thing will cause sepsis and shock in the newborn. Now, how the baby will present? Firstly, the baby will have bloody stools. Then there are chances of abdominal distension and eventually circulatory collapse. When the abdominal X-ray of the baby is taken, then we can see gas within the intestinal wall. Now, this thing is termed as pneumatosis intestinalis. As you can see, there is gas trapped inside the intestine. Now, if this condition is diagnosed initially, then it can be managed conservatively. But in most of the cases, it is diagnosed little late, because in which there is 20 to 60% chances of that there could be resection of necrotic segment of bowel. Now, it is associated with perinatal mortality. If the baby survives necrotizing enterocolitis, then there are chances of post-NEC strictures. Now, which part of gut is involved? Mainly terminal ileum, cecum, and ascending colon, followed by part of small or large intestine. Coming to gross of this entity, in this the segment which is involved will be distended, friable, and congested. Because of distension and congestion, there are high chances of perforation. Because of perforation, there can be peritonitis can occur. Coming to microscopy, there is mucosal or transmural coagulative necrosis, ulceration, bacterial colonization, and submucosal gas bubbles. Thank you.